once you've removed the pericardial sac from the heart and you have carefully removed some excess adipose tissue from around the blood vessels, the next thing you have to do is orient this heart. The apex of the heart points inferiorly. The base points superiorly. I'm looking at an anterior view of the heart. I can tell that I'm looking at the anterior view because of this line right here. This is called the anterior longitudinal fissure. Okay? And if you notice, the anterior longitudinal fissure is parallel to the left side of the heart, so it's slightly angled. Another way to identify the anterior longitudinal fissure is that it is found between the left and the right atrium. External structures of the heart. So looking at the heart from an anterior view, the structures that you have to be able to identify are the following. The anterior longitudinal fissure. This flap here, this brown flap, is called the left auricle. The brown flap up here is the right auricle. Underneath the two auricle are the atria, which are the upper chambers of the heart. For our purposes of this dissection, we'll simply call the auricles atria. So we'll call this the left atrium, and we'll call this the right atrium. Another structure you have to be able to identify from an anterior view is this vessel right here, found between the two atria. This is called the pulmonary trunk. The last couple of structures to identify from an anterior view are the bottom chambers of the heart, called the ventricles. This is the left ventricle, and this is the right ventricle.